Well, in today's session, we are going to have a very short discussion on three must know terms, which are CBME, second one, competencies, and third and the last one will be SLOs. Well, इनके लॉन्ग फॉर्म्स तो हम आगे देखेंगे, but just remember that this all these terms are going to be every now and then bombarded in your ears throughout your medical education, and so इनके बारे में थोड़ा तो जानना बनता ही है और जरूरी भी है. So let's see these terms one by one. Okay. Now these terms were introduced by NMC, that is National Medical Council of India, way back in 2019. In 2019. Now, how they introduced it? They introduced these terms in the form of a new curriculum named as competency based medical education. So let's write competency based medical education. Now, this competency based medical education curriculum is more popularly known by its short form called as CBME. Okay, so this CBME का long form जानना आपके लिए बहुत जरूरी है, because this long form is being asked in many oral vivas in final examinations, and unfortunately many students are not being able to answer the simple long form of this CBME. And this CBME is the new curriculum in which you are going to pursue your medical education. So इसका long form तो जानना mandatory है, ठीक है, आना ही चाहिए. Okay. Now this new curriculum of CBME is expected, or I must say that is being rather rolled out throughout all the medical colleges of India, that too uniformly. Why this is being uniformly implemented? Because their ultimate and uniform aim is to produce an Indian medical graduate on a uniform platform throughout all the medical colleges of India. Okay. Now we will be exploring this concept of Indian medical graduate in detail further in our session. But for now, the reason why I'm saying that this terms CBME, competencies, and SLOs are must-know terms is because all the medical syllabus of the different years, as well as the different examination patterns of this different MBBS examinations, will be in accordance with this new curriculum of CBME only. So now it's become mandatory to at least know some basic points of this new curriculum of CBME for each and every medical student. So let's start with two most basic points, which are first, competencies. By the way, the short form of Indian medical graduate can be or is IMG rather. So again, let's start with the most basic point, that is competencies. Okay, now what are competencies? Competencies are nothing but an observable abilities that includes multiple components such as knowledge, attitude, skills, and values. I am again repeating, what are competencies? Competencies are nothing but an observable abilities of learner that include multiple components such as knowledge, skills, attitude, and values. ये थोड़ा कॉम्प्लिकेटेड स्टफ हो गया या बुकिश स्टफ हो गया. लेट्स ट्राई टू सिंप्लीफाई. सरल भाषा में कहो तो competencies can be any way or process or even method to assess the competence, or we can say the ability of the medical student in order to be called as Indian medical graduate. Okay, so this can be called as competency. Now let's see what is specific learning objective. All right. So what is objective? Objective is nothing but a statement of what a learner should be able to do at the end of a specific learning experience or specific learning session. Again, this seems to be bookish, so let's again simplify it. So objective मतलब क्या है? Specific learning session, that it may be lecture, practical or tutorial. इसके बाद learner, that is student, ने क्या सीखा और सीखने के बाद वो क्या कर सकेगा, इसकी accountability को हम क्या कहेंगे? Objective कहेंगे. It is that simple. Okay. Now let's jump or focus on this new concept of Indian medical graduate. Right. Now who can be called as Indian medical graduate? Well, any medical student who has successfully cleared all the examinations as well as different levels of assessments in the prescribed years of this new curriculum of competency based medical education can be simply called as Indian medical graduate. पर इंडियन मेडिकल ग्रेजुएट बनना इतना आसान नहीं है. क्यों? क्योंकि इंडियन मेडिकल ग्रेजुएट should have the following characteristics, and there are 5 main characteristics जिसे याद रखने के लिए I have a very simple trick for you, and the trick is Indian medical graduate should be race in knowledge. So race in knowledge is a trick. So race, that is RAES. So let's see what R stands for. Alright. So R will be standing for responsiveness. Okay, so Indian medical graduate should be having this characteristic of being responsive. That is, he should be able to respond at any time of the day and at any emergency voluntarily for giving the patient care. Okay, now second of race would be with A. Now let's see what A stands for. Okay, the A stands for having proper attitude towards this noble profession. So in accordance, this Indian medical graduate should not be careless or should not be negligent in catering different medical services in that particular subject, okay, or in that particular medical branch. Alright. Now next is E. Let's see what E stands for. E stands for different ethical values. It is mandatory and expected that Indian medical graduate should do its medical practice only in alignment with the different principles of bioethics or ethics or medical ethics. Okay. Now let's see what S stands for. Well, S stands for different skills, or rather different diagnostic and treatment skills that Indian medical graduates should possess in order to cater its medical service in much efficient manner. So the fourth characteristic is having requisite skills. And the final and the fifth characteristic that Indian medical graduates should have is the requisite knowledge, obviously. So Indian medical graduates should have requisite knowledge in the different medical branches so as to be able to apply it efficiently while doing its medical practice. Okay, so why this Indian medical graduate needs to have all these characteristics? Because it can play different roles in the society. So now let's see what are the different roles in the society. Now these were the characteristics, or these were the different abilities. Huh? So this will be asked in the vivas, and even this can also be asked in the viva, or rather this is asked in the vivas also. Okay, so now let's see what are the different roles of Indian medical graduate. So he should be a good clinician, first one. Then he should be a good leader, or at least a cooperative healthcare member. The second one would be a leader and cooperative healthcare member. Then he should be a good communicator. So third one would be a good communicator. The fourth one, he should be a lifelong learner. Life भर पढ़ना पड़ता है डॉक्टर लोगों को. Yes, he should be a lifelong learner. So the fourth one, he should be a lifelong learner. And fifth one and last one, he should be a thorough professional. Again, to remember these rules, I have a very simple trick for you. So let's see the trick in the next slide. The trick is of Indian medical graduate rules, and the trick goes here as it is. Okay, here it goes. So the trick is the clinical leader and member should be a lifelong learner and communicator professionally. So what are the 5 rules now? He should be a good clinician, and he should be leader and member of healthcare team. Then he should be a lifelong learner. He should be a very good communicator, and he should be a thorough professional. Now let's explore this individual terms a little bit, not in detail but a little bit. So what exactly means being a good clinician? Being a good clinician means the Indian medical graduate should be able to provide different care, such as preventive care. Then comes promotive care. So let's write promotive care. Then comes curative care. So let's write curative care. Then comes palliative care. And finally, it should also cater with the holistic care, and that too with compassion. With compassion. Okay? So what are this meaning of this different cares? Preventive care means care that is given to prevent the occurrence of particular disease. That is, iron tablets are given to prevent the occurrence of iron deficiency anemia in pregnancy. So this is preventive care. Promotive care. Promotive care means promoting different healthy eating lifestyles so as to prevent different sedentary lifestyle disorders such as diabetes, hypertension, etc. Now, curative care means deals with totally with the treatment part. Curative, that's treatment part. What is palliative? Now, this might be new for you. Palliative care means the care that is given in the life-limiting diseases. That is, the purpose of this care is only to limit the suffering. It will not be dealing with the treatment of disease, or it will not dealing with the prevention of death. Okay, so this care is given only in the end stage diseases. And finally, holistic care. Holistic care deals only with the physical, mental, as well as social counseling of the particular patient. Okay. Now, second, leader and member of a particular healthcare team. So, this Indian medical graduate, as a leader or as a member of healthcare team, should be able to collect, then analyze, then synthesize, and finally communicate. क्या communicate करेगा वो? Collect करेगा, analyze करेगा, synthesize करेगा, and finally communicate the health data, and that too to a proper authority and in appropriate manner. इतना आना चाहिए उसे. Okay? And lifelong learner, lifelong पढ़ना ही पड़ता है. So, lifelong learner means the Indian medical graduate should be committed for continuous improvement in skills and knowledge. So that it can keep itself updated with the recent advances or technologies in its particular medical branch or in its respective medical branch. A communicator. The Indian medical graduate should communicate regarding the health as well as disease in a very humble as well as effective manner, so that the purpose is solved to the patients relatives, that is families, also with the colleagues, and finally with the society. Okay? And how it should be Indian medical graduate? He should be a thorough professional. That is, he should be committed to excellence. That too in ethical manner. He should be committed to excellence but in ethical manner, and should be accountable towards its profession. Okay? This means he should be a thorough professional. And finally, after learning about the different characteristics, the different roles of Indian medical graduate, now here we are towards the end goal of Indian medical graduate in this Cbme. Okay? Or in accordance with this new curriculum of competency-based medical education, and this can be asked in Viva as well as MCQs. Okay. So the end goal or ultimate goal of Indian medical graduate as per this Cbme is that Indian medical graduate should recognize health is for all. Okay, so it should recognize that health is for all, and health is the basic right for all the citizens of India. With this ultimate end goal, we come to an end for this session. So this is Dr. Ravi Raj signing off for now, only to see you in our next session of cellular biology. Till then, bye bye, take care, and do stay safe. Thank you.